Do you second guess yourself when you are taking an exam or a high stakes assessment? Do tests increase your anxiety in a way that makes it hard for you to comprehend the questions that are being asked? Do you spend hours on your studies and still don't get the results that you are looking for? Get the support that you need to help you get the grades that reflect your efforts. I am here to support you on your journey. You can utilize the podcast, set up tutoring sessions, get some streamlined study sheets, or just get some advice on how to tackle testing in dental hygiene school so you can put those really important 3 letters after the name that means so much to you. The Happy Flosser is here to support you to make your path to becoming an RDH a reality. Links to many helpful resources are in the show notes of each episode. Have you checked them out? Perhaps there is something there that may help you. Happy listening. Hey everyone! Welcome to the Happy Flosser podcast. My name is Billy Luntz. I am your host, and I am here to talk to you about all things dental hygiene, to support you on your journey through the dental hygiene program. It is so great to be with you today. And today we are going to be talking about general pathology. You have some general pathology on your board exams. It kind of sneaks in there. If you look at the candidate guide, it says in that specific dental hygiene questions, there are 61 of them, it says general and oral pathology. So I wanted to make sure that you had some understanding of general pathology. There's another little section under the perio part that says etiology and pathogenesis of periodontal disease, and that is part of general pathology as well. So once you understand general pathology, you can kind of dive into oral pathology and the pathology related to different systemic illnesses and periodontal disease, which is mainly what we focus our attention on in dental hygiene. But there are some general pathology questions on your board exams. So I wanted to be sure that I highlighted those for you here if you are someone who is studying that and getting ready to take your board exams. Or if you're in dental hygiene school, there's bound to be a question or two that come up on pathology. So pathology is just the study of disease, right? The structure and the biochemical changes that lead to functional changes in the cells, the tissue, and the organs. So think about pathology as it relates to periodontal disease. We know that there are structural and biochemical changes that lead to functional changes in those cells, tissues, and organs. So that's where pathology kind of connects the dots to perio. So when you have structural changes, functional changes, or biochemical changes in the body, we know that when it changes the cells, the tissues, and the organs, it leads to disease. Pathology is the bridge between the basic sciences and the clinical medicine. It provides us of a link between the two. It helps us as providers, as healthcare professionals, explain the signs and symptoms that are manifested by our patients. It also helps us connect the dots and provide rationale for appropriate clinical care. And then treatment recommendations that we know may work for our patient based on what we know and what we see. So if you just consider taking pathology and dividing it into 2 broad categories, you have general pathology and then systemic pathology. General pathology, there's common reactions of all cells and tissue, and they respond to any sort of injury or stimuli. It's really not specific. Inflammation would be a great example of general pathology. We know what the common reactions are to inflammation. All cells and tissues respond to inflammation. And then we have systemic pathology, where the mechanisms in organs, they are very specific to specific diseases. And that would be something like the pancreas reaction for a diabetic patient. So let's break down pathology into 4 main categories: etiology, pathogenesis, morphologic changes, and then clinical manifestations. So etiology is the cause of the disease. Is it a genetic? Is it genetically acquired, or is it acquired through environment? And it's idiopathic. There's multifactorial idiopathic ways that the causes of disease occur. And then there's pathogenesis. That is the mechanism of disease development, the progress and the outcome of the disease. Morphologic changes, those are the structural changes that occur as a result of the disease at the cellular level. And those morphologic changes are characteristic of the disease. So we know morphological changes, bone loss would be a morphologic change of periodontal disease. That is a characteristic of periodontal disease. It's a diagnosis. You can actually diagnose periodontal disease by looking for that morphological change as an etiological process. And then the fourth category of pathology would be clinical manifestation. What are the signs and symptoms? What is the clinical course and outcomes, and what causes the signs and symptoms? So think about periodontal disease. You've got the microbiology. So we know that certain pathogenesis, right? So the pathogenesis occurs, the mechanism of disease development happens when you have a susceptible host, you have the right pathogens in the mouth, you have time, right? And you have the right environment. So when we look at the etiology and pathogenesis of periodontal disease, we look at the different factors associated with the patients that we see and how those manifest themselves and present themselves in the clinical setting to help us. We look at those clinical signs and symptoms and we align it with the morphological changes. And we know that periodontal disease starts at that cellular level. We get the cell injury, it turns into tissue injury, and then it becomes a systemic injury. But it all starts at the cellular level. We know that there are different risks associated with the etiology of disease. We have two categories that we put those risks into. We have modifiable risks. Those are things that can be avoided. Things like smoking, poor diet, sedentary lifestyle, poor physical activity, stress, right? All of those things can be modified, but also those are leading risk factors to cellular injury. And then there's non-modifiable risks. Those cannot be avoided. Things like age, gender, genetics, ethnicity, and different medical conditions that people present with. All of those are non-modifiable risks that are associated with the etiology and development of disease, especially periodontal disease. This is something that is in your wheelhouse, so you can connect the dots here on pathology and the development of periodontal disease. So when we think about the clinical manifestation, so we're looking for the signs, we're looking for objective and measurable signs, bleeding on probing, the clinical attachment loss, we're looking for the bone loss, we're looking on the radiographs, we're looking for those different signs of the manifestation of disease. Then we're looking at the symptoms. Those vary from person to person. Those are the feelings. What is the patient telling you? Are they telling you anything that could be related to that diagnosis? And then the syndrome. So those are a collection of the signs and symptoms that occur together and may present differently in different patients and different diseases, different pathology that they present with. So not everybody looks the same way when they show up in your chair. You could have two different people have the very same disease, the very same prognosis, and they present completely different. So let's think about the etiology and pathogenesis of disease manifestation, specifically related to periodontal disease, because this is really important for you as a dental healthcare professional to really understand, and then understand the stages of disease. That's really general pathology in a nutshell. So what do we need to know? We need to know that the etiology and pathogenesis of periodontal disease is associated with gram-negative species of bacteria. those liposaccharides, the LPS endotoxins, the gram negatives, they induce and stimulate the inflammatory response. And that stimulates the osteoclasts, or bone resorption. We look at the clinical signs and symptoms of our patient in order for us to connect the dots on the morphological changes that lead to a disease diagnosis. It's important for you to consider that gingivitis is not detected on radiographs, right? That is bleeding on probing and inflammation that we can see in the mouth. Destruction of the facial and lingual cortical plates is often worse than it appears and not always seen on a radiograph. So those early stage periodontal disease diagnoses, it's really hard. Smoking, poor oral hygiene, stress, and comorbidities can contribute to the disease process. And it's also important for you to know periodontal abscesses can occur after non-surgical periodontal therapy is done. Lymphocytes, plasma cells, and PMNs are found in chronically inflamed tissue. Once gingivitis advances to periodontal disease, it is irreversible. It's important for us to share that with our patients. We have that apical migration of the junctional epithelium and the bone loss and destruction of the periodontal ligament. The inflammation invades the bone and destroys the periodontal ligament and gingival fibers. Our patients don't really know because they don't feel most of what's going on in there. It's hard for them to understand what we're sharing with them. So the other challenge for you will be the educational piece on the etiology and pathogenesis of disease manifestation for periodontal disease for each patient that we see. So the stages of disease: latent, that's from etiology to the first sign and symptom of the disease. Prodromal is from the first sign and symptom to the specific symptoms. Period of expressed clinical symptoms is more specific and can determine that disease is present at that point. And then the last stage of disease is the outcome. Are you going to have recovery, or you're going to transition to the chronic form of the disease? Which direction is your patient going to go when we process and treat our patient? What is the outcome? So obviously, for a patient who has diseases outside of periodontal disease, something more serious, maybe the periodontal disease is a contributing factor, you have recovery, transition to a chronic form, or death. So those are your three outcomes of the disease process. Recovery can be either complete or incomplete. And most of our patients, the outcome of their periodontal disease, they transition to chronic form, because we know that periodontal disease is episodic in nature, that it ebbs and flows. Your patient will go from your patient will go from their periodontal disease being kind of dormant and not in an active infective state to more stable, because we have helped them find their balance point in their management of their disease, and we've stabilized their disease progression. So they've gone from maybe a grade C to a grade A. Maybe some of their comorbidities have balanced out, and they have been able to better control their disease. So they've turned into a more chronic state where you have stabilized the infective process, and so now they no longer have active infection going on. Or maybe your patient has all different comorbidities that are unstable, and so the recovery is negative and they're not able to stabilize their periodontal disease. So it all depends on, there's lots of factors involved with pathology and the etiology and pathogenesis and disease progression of your patients. Hopefully, this helps you understand general pathology just a little bit better, and then you can dive into oral pathology and then the pathology of periodontal disease as you're studying and getting ready for boards. I hope you guys have a great week. I'll talk to you soon.